Hello, I'm Kalani. I'm going to be going over my senior practicum project. The topic is purposeful rounding. So what is purposeful rounding? It's defined as assessing and responding to patient needs on a regular basis by Greiner et al. A regular basis is going to be every 2 hours. Rounding on these patients can reduce the use of call lights and increase patient satisfaction. So when you're going in the room, rounding on a patient, you should be assessing pain, positioning, potting, possessions, and pump. And by implementing rounding interventions, and can promote staff responsiveness and patient communication. And the nurses can enhance patient satisfaction and patient safety outcomes. So the goal of this project is initially we want to enhance quality of patient care and nursing care. So enhancing these things will reduce patient need and in turn reduce call light use, which will in turn result in increasing patient satisfaction rates. So the objectives of this project are, one, to make sure that there's an understanding of the 5 Ps and their impact on patient care, the 5 Ps being what I just mentioned. The implementation of the rounding tool on the unit, so having nurses be taught about the tool and then use it in their daily care, and then evaluating the effectiveness of the tool. So let's talk about strategies and how we want to get these objectives across. So initially, started out with a literature review, finding some evidence-based practice articles related to purposeful rounding. I went ahead and found the current facility policy on purposeful rounding for where I'm employed. I created a lesson plan, and I used that lesson plan to teach the nurses on my unit about the rounding tool, which I'm kind of blocking here, but we'll go over in a second. So the rounding tool, again, assesses those 5 Ps. So pain, you want to ask, how are you feeling? Are you comfortable? Are you uncomfortable? Are you having any pain? And then what would you rate that pain on a scale of 0 to 10? When it comes to potty, instead of saying, do you need to use the restroom? I think that it's more effective, or I've seen that it's more effective if you offer, hey, let's try to go to the restroom. Let me assist you to the bathroom. That way they're going and they're able to relieve themselves. Positioning, so would you like to get out of the bed? Would you need some help? Let me help you reposition yourself. And then possessions, you want to make sure that everything, so the bedside table, make sure that everything's in reach. This is going to prevent falls, prevent any type of injury, knocking over things on the floor when it comes to like trying to reach and get those things. Can I get you a fresh water? Is there anything else that I can get you before I leave? And then for pump, you want to make sure that the IV pump is working correctly, that your bags don't need to be refilled. The purpose of doing that is while you're in there, let me go ahead and take care of it. That way, when you step out of there, you don't have to run back in there because it's beeping. Go ahead and take care of it while you're in there. Be intentional when you're in the room. So once this tool was created and explained to the nurses, we did staff training session using that lesson plan and using some role playing. And then I went ahead and observed the staff using the rounding tool. So some supportive evidence. So I used survey. I used a survey to go ahead and ask the nurses that were trained how they felt about the rounding tool. So I have some examples of the questions there. Initially, 16 nurses were trained on how to use the rounding tool. Only 12 of them responded to the survey, so that gave about a 75% response rate. I will say that using the survey, it was beneficial because I was able to see on a scale what the nurses thought about it. So 100% of nurses agreed that the tool made the rounding process more efficient and that the 2-hour rounding interval was a good time frame for them to be going back into the patient's room. The survey also assessed the tool's effectiveness in monitoring patient status. So 83% of respondents rated the tool a 5 out of 5 in that regard, with only 16.7%, which is really 1 out of the 12, rating it a 4 out of 5. So for the examples here, I asked, how would you rate the effectiveness of the tool in increasing patient satisfaction? 11 out of the 12 patient or nurses rated it a 5 out of 5. So that's good. We want to see that there's overall satisfaction for the patients when using this. Did the tool decrease the use of call lights in your patients? Majority of the nurses said yes. And then overall, how would you rate the hourly rounding tool when it comes to assessing the 5 Ps? So across the board, everyone rated that a 10 out of 10. So when it comes to outcomes on the PCU, obviously it was highly successful based off of the survey. Majority of that feedback was positive, and that highlights the effectiveness of the rounding tool on the unit. So I would say that the tool succeeded in improving quality of patient care, increasing rounding efficiency, and then reducing the call light use. So while the tool's impact was largely positive, there are also some opportunities for improvements in the future. Some comments that were made in the survey when it comes to nurse feedback on what to improve or positioning of the tool on the room door, and then it being a little more specific, tailored to that patient's needs. So those are some things that can be improved. So purposeful rounding in practice, how are we going to apply this? This tool gives the nurse the ability to anticipate a patient's needs. So you're going to regularly check on the patient's status. When checking on the status, especially on a PCU, when you have patients that could be in a semi-critical state, this is going to give you the ability to identify early signs of deterioration. And then with that anticipation of the patient's needs, it can reduce the use of call lights because you're going in the room and you're checking to see if they need any pain management, see if they need any repositioning, see if they need any toileting. That way they're not having to call you. You're already in that room. This is going to lead to improved patient safety also, because your regular checks are going to reduce falls. It'll reduce pressure ulcers as you're turning them every 2 hours, and then other preventable complications. So enhanced satisfaction of patients. It comes in when you're going in and you're checking on these patients regularly. They feel less anxious and they feel more cared for, being that you're coming and checking on them on your own time versus them having to call you. And then again, with the decreased call light usage, some research shows that anticipating needs of the patients will make them less likely to call, which leads to fewer interruptions. So let's talk about the value of this learning in my lifelong practice. So using this tool on my unit gave me practical experience. I was able to apply this project in real world setting, which allowed me to become more familiar with purposeful rounding, the best practices that are related to that. So that includes patient care, it includes the safety and the nursing technique best practices. Time management and organizational skills play a role because the purposeful rounding tool encourages managing your time when you're going in and you're checking on the patient every 2 hours. So that leaves you time to prioritize other tasks in between going into that patient's room. Commitment to continuous improvements. This project taught me that patient care is a dynamic and evolving process. So I was able to understand that there's a need for continuous reflection, there's a need for feedback, and there's a need for improvement when working in the nursing field. So that comes with anything. If you ask a patient a question and they give you an answer at that moment, when you come back the next time, it may be something else, or it may be that you need to improve the way that you're answering what they need. So finally, understanding quality care metrics. So by adapting the purposeful rounding tool into my daily routine at work, I was able to develop an understanding of how it contributes to overall quality improvement in hospitals. So that could be reducing hospital acquired conditions like bed sores with that every 2 hour returning, and then improving patient satisfaction overall. And finally, here are my resources. So thank you for your time.